Hello.
Hi. How are you? How was your week?
Um, like horrible, cause I'm in limbo with this bullshit because again like they're making me extra sick. I think, cause I mean your usual methods of you know oppressing me and scaring me aren't working. So my kid is sick again. He's sleeping, and after like confronting you with why don't you, I know you're an FBI agent, why don't you give me a contract, um and nothing happening like in response, being that I would expect in casual manner to um be again institutionalized for this, or you know somehow reprimanded,
Do
but
you
all
want
of
to be
the business.
institutionalized?
No, I don't, and I don't want you to call the ACS, but I feel like it's necessary that somebody deal with this situation because my son is not healthy here, and I don't understand where this is going. What I want you to do is go to your FBI boss and discuss the situation with him.
Hold on, I will stop you here. You can finish this conversation and call the clinic right now and repeat exactly what you said because I truly don't know where this coming from and where this idea was born that I'm an FBI agent. I understand that in your reality this makes sense, but now you created this reality, alternative reality, and you're expecting me to do certain things that
But it's not
I
an
did not,
alternative reality.
and
It's
I will never do. No,
it's
but
it's
it's
that
not true.
you expect me to be dismissive of the situation, being that what you perceive as normal people, your coworkers here and there, and it's become absurd how many people do work for the FBI in New York
Hold on,
City.
you're generalizing. I don't know where you're getting this information from, but our conversations.
Well, you only register information jurisdictionally, right? But I'm out on a limb here on faith, and I register information physically. And you know what? Even though I have a cold, I have not been on drugs. I'm not on your drugs, which you want to push down my throat. And I'm sure if you don't do it, the people tomorrow, when I'm confronting them at my appointment, at my week-care appointment, they'll try to do it. But being that we've been in this conversation for so long. Oh, I have a week care appointment. Being that we've been in this entanglement so long, I feel like the FBI responsibility falls on you.
I don't know what else to tell you. I think I am done here, and I will be dismissing your case and reassigning it to somebody else because I don't know where all of this coming from. And for a few months now, you're talking about that I'm an FBI agent and I should do something. I'm not going to do anything because I'm not an FBI agent. And since this conversation is no longer about mental health, I will.
It is about mental health. So wait. So you're gonna dismiss me. The last person dismissed me. So what's going to happen with the next person?
I do not know, but I highly recommend you call the clinic and ask to speak to my supervisor or to clinical director and clarify all of that because I can't no longer.
Well, what was your plan? What were we gonna talk about? Because I could sit here and quietly comply. But I'm just wondering where it's gonna end up for you as well.
It is not about that. It's not ending anywhere because this is my job. That's what I do Sunday through Thursday. I'm just talking to people who got some, mental health struggles, or maybe some problems, or maybe some depressions, or maybe they overcoming some difficult situations in their life, or maybe they're going through divorce, or maybe their child is sick. There are various problems that people might have. But listening for months that I'm an FBI agent and I should do something, that's beyond my patience, and I just want to continue. So please call the clinic, and I'm done.
Wait, so you're gonna dismiss me now when I need you?
No, because you do not need me because there is nothing I can do.
Yeah, I do, because you know what? I'm struggling with this week-care appointment, and now you decided to dismiss me, and this is not a conspiracy then.
No, Ilona, you're generalizing and saying that me and my people and my bosses, I just can't hear this.
I don't know who your boss is at the clinic. They have not presented themselves with any idiosyncrasies as to mental health care. You, however, and my previous therapist have. And it was sort of duly noted by my friends. Whether they want to represent this information jurisdictionally or not. So I want to sit here and listen to what your suggestions are, because I don't want to switch therapists every 5 minutes. And I feel like as a patient, I have not. What line have I crossed? So I don't cross it again, because you did not give me fair warning of this.
I do not have any suggestions, Alona. I'm just telling you, and I told you that last week and the week before, and back in like probably January or February before I left on vacation, that there is nothing, the commonalities that you see, they are not realistic. I understand it's your perception, and this is what you see, but it doesn't mean that's true. You haven't even visited the office in person. Like, for the time being that we worked together, which was over 2 years now, you haven't even visited the office. You don't even, like, know how it looks like anymore because we opened the other side of the office a couple of years ago. But you're sitting and telling me that I'm working with FBI without developing this structure of like, okay, if you were poisoned with the food, why not reporting this food or contacting?
I did report this food. What do you have to say about that? You're saying that, you know what, I'm completely delusional?
I'm not saying, look, I don't like when people put words in my mouth.
So what do you have to say about that? Because I told you I did report this. And I reported my neighbors as well. I reported my neighbors as well.
I think there should be done reevaluation because what you're presenting with is definitely beyond just generalized anxiety and unspecified depression. What we're dealing here is something different. Because the fact that you're thinking, or if someone is following you, we're talking about a different diagnosis. And something tells me that this is beyond the help that I can provide.
So I think you suspect that I'm actually sane and I'm telling the truth, and you're at odds again because of your career, and this is the problem. Because the issue is that you go back and forth from, oh, you know what, it's just like some lighthearted bullshit, to now you're a nut, and I don't think I'm a nut. I would expect someone to react like I'm a nut when I say things like that, but I think you suspect that I'm telling you the truth, that they have been putting things in my food and my neighbors are harassing me. I believe the cops suspect this as well. I just don't understand how you could just sit there and be this flippant, like it's not really relevant to you. I just don't understand. Apparently you can be. It doesn't make me emotional about your person. Again, because Anna, I told you that this isn't personal. I feel like you've gotten personal with me. I feel like some of my friends would have noticed that. Like beyond, your Call of Duty, so to speak. Because you think that, this is sort of like ultra meaningful, that you're sitting there with some sort of degree in judgment. And I think it's more meaningful that somebody investigate what's going on here, which is real harassment.
Well, we're talking about different things because this is not in my jurisdiction. I don't do investigations. I don't work for FBI. I work for NYBCC. And if you're not happy with what you hear, see, and how our conversations are going, I encourage you.
I'm not happy with you leaving. I don't want you to leave. I don't want you to leave. Because the last one left me too. I don't think it's a cool idea for you to leave. I think it's better for you to stay. How come you don't want to stay? What line did I cross? Because you're the kind of person used to thinking within jurisdictional boundaries. Now jurisdictionally, what line did I cross that you're leaving me when I am having a stressor?
I'm explaining to you because this is mental health clinic that helps people with certain mental struggles. What you're presenting, it's beyond the diagnosis that you received 10 years ago. People changing more often than once in 10 years. And since you're very opposite from any change, you're not following any recommendations.
Which recommendations was I not following?
You have the right for your perceptions and the way you see life, as much as I have the right. If I don't see that my job here is needed, I'm just going to discontinue. If you don't want to disenroll from the services, you will be just working.
But what recommendations am I not following?
You are very opposite from checking in on your health. You are very opposite from doing reevaluation. The words that you're using about putting meds to your throat, it's impossible. Because
I couldn't hear what you just said. Can you just repeat that? I just couldn't hear you on the phone.
The recommendation, what you're saying about putting shoving medication into your throat, it's impossible. Because as you speak to psychiatrists, they recommend, and you either accept or not. Believe it or not, sometimes people will not even pick up those medications. They will say, don't order this to me because I don't plan taking it. This is your decision, but you're trying to put it on somebody else. That's beyond me. I wasn't trained for that. I don't know how to work with some paranoid ideations, what you see and what you hear. I don't know how to work with this. Seriously, I'm giving up. I don't know what to do. And
So
I
why
will
is
think
it that
Now you can't connect me with like, some actual service worker. You could just drop my case like this, like the
sense
pretense
is
is
that
that.
what?
I can just request to be not your therapist anymore because there is no work I can do here. That's it. It's been enough for me. I'm not doing this anymore.
I'd rather you
Not do that because I think it's more than rude. I think I perceive this as totally dismissive, like you took a free ride on me and now you're passing me along. And it also puts me in a mental frame that, you know what, none of these people are here to really help me. It's just
a matter of what.
whether they stick to the protocols on a free ride or not, you know? So apparently your protocols have more to do with your emotional state than they do with mine because I was telling you all this, like you said, for months now. And you're going back and forth between what
You
you
think
think
my diagnosis is?
you think I can get over it, this and that, and you think I can't.
Progress. I can't work with the diagnosis that was set 10 years ago. I can't work with this and I won't work with this. I don't know what free ride here you're talking about. What do you mean by free ride, actually? What is it?
Well, what is it that you do?
Exactly.
Well, if both of us cannot answer what am I doing, that's why I should. Don't you think?
Well, it feels like you're using me because, like, I'm telling you
That I have a stressful thing to deal with tomorrow, and today is the time you choose.
just to drop me.
But you're not dealing with those stressful things.
How am
You're
I
not
not dealing with?
Them. I'm going to this appointment, right? I'm gonna look them in the eyes and I'm gonna tell them just what you told me, and they might recommend that I see some other help. That's true as well. I'm just giving you this because
I think you have more understanding of what's going on than you let on.
If you think that I'm working for FBI, how is this I'm helping you with this appointment whatsoever? I don't understand that. You see, a lot of statements, they don't
I
make
think
sense. They don't
it's
connect.
You dropping me. You know, sometimes it's what we don't do. You dropping me at the last minute, right before this appointment.
It's not the last
It
minute.
can be seen as
It is
you
not the last
giving me even more emotional stress. That's
Sure,
what it
it
could
is
be
emotional
seen as.
stress. But I value my professional, the accuracy that I'm working with and understanding that there are certain things I cannot do. I value more. Your emotional stress, I am sorry for that, but also there is nothing I can do to change your stress because everything we've been talking about, it's not changing it. So maybe I'm not effective to you and you should speak to somebody else.
Well, couldn't you wait till they recommend me somebody else?
Who they?
The We Care services. Until I have a good conversation with them.
What are they supposed to recommend to somebody else? If you're receiving your mental health services from NYPCC, We Care has nothing to do with NYPCC. This is not connected. Again, services are going separately. They're not connected. You can do any services in New York City. It's not about your zip code. It's about insurance more than anything. If your insurance covers that, that's a green light. You're not, for 10 years you've been the client of NYPCC, and what do you think what's the change for you? What is this helping you with? Because you showing up on the session for 4 weeks in a row and telling me that first you think and now you're fully sure that I'm an FBI agent, I don't see any progress here. And I don't
It's
want
not about what I
think, Anna. It's actually about jurisdictional evidence, isn't it?
like it is with you. Like
Jurisdictional
you are
evidence.
Authority. You have the authority to just drop me as a patient, and the pretense is
that we've had that you
actually care about, what being therapeutic and, what
my emotional state
I think that was vague.
big at most, and now it's become completely fake because I feel like I've
Stressed you out because I'm right and I'm telling the truth. And again, you're trying to utilize the healthcare system to oppress me. Just
like they use the free welfare state to poison healthy people with healthy minds.
in all of this, you're using big words without fully connecting what it actually means.
What does it mean to you?
Because oppressing, it's not me stepping back from when I see that there is no longer any progress giving. This is not oppressing. You should seriously.
I
You
just,
should speak
you know,
to
there's a
somebody
way
else.
to
Emotionally manipulate people to actually make them productive and to make
them
Is
feel
that
good.
what you're doing?
Is that what you're doing? That's what I feel like I've been trying to do to you, but you're not really going along with it. You'd rather, play toy games and really like destroy my ego.
And I'm a very, very, you know, I'm not a,
like,
what do you call it? I'm not a very arrogant person. What it takes to destroy me is actually very basic things, like, food and shelter. And that's what the system's doing to me.
Ilona, I think your case
And using my
specifically-
children to,
Your children? What about your children?
like, they don't eat the same food that I eat.
Okay, I repeat myself that this is beyond my competence. You can call it big words, oppression and everything. I don't know what you mean by those words, though. I don't know what you mean. Because even though you said that I had like some sort of degree, I have a degree in social work. So I studied oppression, including that term as well. When I know that this is beyond what I can do, I'm no longer that, maybe young and naive that I can think that I can change the world and stuff like that. If I see that I'm useless, I better step away. I'm not going to prove anything to anyone. And you have the right to feel your feelings, I'm telling you. I encourage you to call the clinic and speak to somebody like above me. Speak to my management, speak to my supervisors.
Can I please
anyone.
tell
You what I think before we do
this? Because, like, I don't know in
what like way like I don't work for MRTCC. You're gonna drop my case.
in I don't know what fashion you're gonna dismiss it. Because I think that tomorrow when I go and I confront them at WeCare, you just want to get lost in bureaucratic garbage. You just want to pretend you weren't here for the past 6 months listening to me. And that's sort of sad. I don't know why people can't stand up for the things that are truly right and just. And it seems like you're hiding behind your degree. What's definitive as oppression from like 100 years ago is not necessarily what's going on today. They say that once they often even call psychology a pseudoscience because of this. Because you people need, beyond seminars, you need to have feelings. And I feel bad for you. I felt bad for you before that maybe your feelings were manipulated, and I've let you know as much. But again, the end game in this scenario does not seem to be to make me feel good about myself, to make me feel empowered. It seems to me to write it out and manipulate me into some sort of state. And I know that it's coming from more than just you. It's coming from the neighbors. It's coming from the neighborhood that pollutes my food. And it's very scary for me to exist in this state. And I think it's very dastardly of you to play this coy game. Like, I'm going to drop you the day before your appointment. Because that, even like a child could see, is sort of weird.
You see, you connecting the dots that were not supposed to be connected. The reasoning to my decision, which I was observing about work on reevaluation and the steps to do, was not born today. And I repeat myself, the fact that for the last 4 sessions, you accusing me of being someone I'm not, it's beyond my... Look, as a therapist, I also have dignity and certain things I may not do. Like, we do have the right therapist.
Did I insult you personally?
Is it insulting to be an FBI agent?
It's just not my job, Ilona. This is not my job to prove what I am and what I'm not. If you're here to receive
To me,
service
it's
and
not.
therapy,
To me,
It's not, but can you imagine me and this other little human being
and even my friend that's
really like mentally unwell maybe sometimes?
we're sitting here and somebody's sitting there imagining that you might be working for the people that are just conspiring, just
how
doing
is
money
this my
laundering.
responsibility? How is your thoughts my responsibility? Ilona, you can
Why
think
is it
whatever
just
you
my
My thoughts, though, my thoughts are powered by reality. Why is it just my thoughts? What's the pretense here? That I'm a complete schizo, but you've just been sitting here
doing what then? I'm
again,
not
hallucinating this, that you've been here, I've been talking.
again, you can think whatever you want to think. I'm telling you that this is beyond my level of expertise. There is nothing I can be helpful with. If you do not want to speak to my management, to my supervisors, to the
I do, but not to.
Tomorrow, maybe next week I would, but not like tomorrow, because it just seems like awful, like the play played out. And what was next on your schedule? What was next? Because it seems on schedule. It seems not when it's my time of need, because you could have
Called the ACS before, right? And we could have had this face-to-face conversation. Same way you claim that you care about your patients.
They claim that they care about the children, right? But that didn't happen. Because I'm telling you that my food is being poisoned.
you're not listening. You see, that's another signal. You
Okay,
still thinking that
I'm gonna
I'm an
listen.
ACS.
I'm gonna listen to you.
We don't work together. I don't work with ACS.
Exactly.
So you always bringing this together. You thinking you will call an ACS on me. I can't do that. I don't have anything to do with ACS. I don't work for ACS. I work for New York Psychotherapy and Counseling Center. So all of those suspicious words that you're using in kind of like gently accusing me onto something that I do and not do, that's you have the right to feel your feelings. I have the right to feel mine as well. And since it's beyond my level of expertise, there is nothing I can do here. I will just go ahead and proceed. Whether you will or not talk to my management, that's all right. But I will try to do my best.
Couldn't you just wait until next week?
So when the We Care Services calls you to ask you what we have been talking about,
You know,
I can't speak to any services unless you sign up HIPAA form.
I did. I signed it.
already.
Or
I signed it already. You know, they're not gonna.
Talk to someone here.
You know, they're gonna talk to you because you know we have been talking for 6
no,
months.
that makes sense.
And
You could tell them you're dropping my case because it's beyond. Because I suspect, you know what, they will react, you know, more immediately. Maybe they're
more crude. Maybe that's how you represent yourself. Like you somehow care, you know, about people.
and their emotional nuance. I can understand that too. I'm not even gonna get into, like, you know, what working for NYPCC means.
And that, you know what, also
And I do feel bad for you, but it's also, you don't comprehend what's actually going
on when we're dealing
with this situation.
you know? And you're right.
I'm not gonna drop this issue because it's real. You know, it's really real.
And you know, me being compliant, it wouldn't help. Although, like you said, I wasn't
Compliant with your suggestions, and
I actually want to question you as far as which suggestions, because I have been compliant.
you know, as far as
Just religiously being against, you know, aggressive healthcare,
like medication or, you know, intrusive testing, yeah, I am against it. You know, if somebody wants like a swab of my spit or something like that, I'm fine, no problem for it. You know, you really think weighing
me like a piece of meat is going to resolve this issue? No, I feel like it does have to
do with the
way we process.
our free healthcare, you know?
Yeah, I have been compliant.
Is what I'm trying to say. What I'm
Also trying to say is this is not how this issue gets resolved. What I see is this system narrowing down on us, literally surrounding us,
because we're the strangers. We're the
odd ones out.
We're the ones that aren't FBI. We're the ones that see this for what it is. The food is shit. The food has been poisoned. We're the ones that hear these neighbors. You know? We're the ones that see these stalkers on the street. You know? So we must be mentally ill. Because everybody else is the stalker, practically. I have a few friends that aren't, you know? But they've been, again, scared into submission. And it's sort of sick. You know? It's either really stupid people that get by, you know?
Or the people that walk around with their head down.
And I'm sick of it because it doesn't seem to me like you're so above us. You know, like,
Really?
On something that you mentioned in your statement about me talking to We Care, of course I will talk to them because we've been working together for quite some time, and of course even if you will be reassigned to somebody else, I will speak to them as the person who's been talking to you. This is not even under like discussion. Don't worry about it. Whoever will I need to talk about it, I will address that as well. But I highly recommend you to just present all of this to either the program director or my clinical supervision team, because I'm not trained for this. I don't want to engage all of those conversations not leading anywhere, and I'm hearing.
But they are leading somewhere.
I feel like, and I see your face.
And I see your emotional responses. It's just that, it's like you're fighting for your money and I'm fighting for my life.
And, like,
You think like you lost or something,
already, or it's above you, even jurisdictionally.
and I feel like that's so not true. Like, even people that have participated in a crime or whatever,
Maybe that's why you're doing it. You know what? I don't want to sit here and, like, don't pretend like I'm the evil one that wants to sit here and, like, drink your blood, so to speak. And
drain you of your emotional energies. It's just that I don't truly feel at the core of it
that our system should be so ignorant and have double standards,
and that there should be covert agents working like this. You know? It's not because I've honed in on you,
it's because I'm getting progressively sicker of being
dismissed. You know? So I really freaking hope for the best that
beside dropping me, like, with this.
superficial therapy or whatever, because we could
Sit there and we could play games.
and it would just go nowhere.
I really hope that you actually do something.
In, reserve of humanitarianism and not,
Again, play this bureaucratic game of we know who the poor are, we know who the oppressed are, because I'm telling you right now, if someone was to check forensically,
this food, they would discover that it
has been poisoned, and
and my neighbors,
are FBI, and they've been sitting here harassing us. They have.
you know, and even if it never
Gets to that, I know there's people that believe me from the inside.
so I wish you like would do something for real.
You may wish, but I can only do things that are in the spectrum of my practice. I cannot do things that people wish for themselves, which I understand would be a great addition to my functioning, but I do have certain limitations, and this is one of them.
Also, like sometimes, the game is to ostracize one person, and sometimes that person isn't me. So because sometimes when life calls on you to
Be a hero.
and you deny it, you turn into the villain. Was that vague? Was that like vague and childish, my statement? I think it could be heard as that. That's why I don't want to switch therapists, because I feel like you understand what I just said. Do you? And the next person might not.
I mean, we gotta give chance to people in general. We can't know if everyone will understand or if everyone will not. There is a certainty that somebody will and someone won't, for sure, but it's a give and take.
I don't know. Do you believe that there's more to life um, than money? Because, again, the other side of it is maybe you're finally doing the right thing, because I've been feeling quite morbid with what's going on, and I can't believe the level of this police ignorance. But it's also like this these mind games that this bureaucracy plays, I'm not sure like how to behave in these situations, you know? Because I know that, I'm trying to be a hero and I just don't want to be like coy like that, But nobody wants a needle in their ass or their son that they've been taking care of for 11 years and they taught them how to read and write and not the system, taken away from them, you know? But I'm sitting there like shitting my pants, also thinking, what's this? Like I didn't read your what's it called, DCIM or whatever, the handbook of mental health diagnosis. I didn't.
Oh, DSM.
Oh, DSM. I didn't read that, but I'm thinking like, okay, well, I'm too old, to be diagnosed with schizophrenia. I'm too young to have dementia, and you can readily dismiss me as a healthful person, but then I'll totally wild out because I'm physically sick. I'm physically sick of people putting shit in my food and waking me up in the middle of the night. And I told the police that these people, they don't belong here either, and they're playing stupid bureaucracy games. It's like massively political because, again, what a waste of tax money.
Look, I understand all of that, and our timing is coming to an end today. We may have one or two final sessions, unless I will be very expressive in my case presentation. But let's see what's going to happen, and the clinic will contact you, or you can try to contact either supervision team or the clinical director of the Bronx Department of NYBCC. And that's where I will leave you today. That's what I'm going to leave you today with. But I hope that we
can I give you a final confession?
But it's so superficial. If these people were to let me go home tomorrow and again prolong this and say, okay, you could stay here inside the apartment and you could stay with your son, I would I would be grateful just for that, even though every single day I sit there and I'm like, how are they gonna end this? Like, because I have like one other friend that I know, he's an FBI agent, but he's so aloof and he's like a male and he's large and I don't, whatever. I don't want to fight with him. And you guys play games because you guys got mortgages. And I do feel violent. I feel fucking violent, and I feel disgusting, and I just wish someone would do the actual right thing because it's if you systemically institute this, just like I just I've after this journey I've processed a deeper disdain for a system of identifying emotions, because I see how you implement this shit. So now, like, left or right, man, because I'm telling you, the RFBI, it's sort of sick. Like, I would be sick if I got involved with some bullshit. Why don't you be the hero? Like, please. I promise, like, I won't sue you. If you're the hero, I promise. If word, like, of honor means anything, I promise I won't.
Everything that you're describing, it's outside of what I do. What is We Care going to do? I don't even know this organization and the spectrum of services that they provide. I know that they are a social service organization, but I don't know what exactly they do. And to tell you that I will and will not do something, then you will need to have a caseworker, because therapists, they only provide therapy to connect with other resources to...
See, that's the thing, the lady before you, like, they put you, the lady before you, Mia Geronimo, she knew what was going on, too. And she's sort of trashy because she tried to, like, slam my kid's fingers because she was being, like, bitchy and trashy and whatnot, and all you guys, you have this thing that, like, you think that these people are, like, garbage, because you can, like, see where my motivations lie, but what if somebody sees through you like you see through us, you know what I'm saying? And if you have a witness too, it makes y'all look kind of like,
what's going on, you know?
but I feel like, like, why with this dragged out with you?
So much longer. I felt like, oh my god, this lady, maybe they placed her there to sort of wash away Dania's room, you know?
Oh, because I couldn't prove what
She did.
you know, and up to a certain point.
I wouldn't have been able to prove that you're FBI either or anything like that, and nobody would have looked at it, you know? And maybe like I was sitting there thinking, oh, this is my hope. She's gonna see how
Disturbing this is, and maybe you're the hope of
the neighbors too. Maybe she'll tidy up and she'll present me
to the FBI
as a decent human
being and a misunderstanding and
accidentally in the system. But
please, that didn't happen. Please be the hero, because I'm telling you,
people have this tendency to ostracize people. Just like I've been ostracized for what? For bullshit. For what? For having a wild youth and having children, you know? And what? Not like being super
compliant with, a bunch of
like bullshit or whatever. You know, I've been ostracized like that. You know, I'm just telling you, please, like, do the heroic thing. And thank you for seeing me for the next 2 or 3 sessions, because I don't even know. Like, I wouldn't really
super judge you if
an ACS worker were to show up here either, because again, they stand for we care for children, you know. And I'll freaking flip my camera out on her, and I'll be like, you really care? You're gonna hear this whole story, you know? Because right now he's sitting there, he's sleeping in his bed. And I, unlike the people that would ostracize you, actually am grateful that you didn't call one, because again, they in the line of duty have their protocols, which are limiting, you know? So it might be, and I'm super fucking scared, I'm sorry I'm keeping your time, of like the EMT or like the police, like normal people are, because they don't have time. They're like action satisfaction on their protocol, usually. They're like, oh, you said something crazy. Bam,
you're down.
You know?
But lately, I don't know, maybe
if it's not just me, because our state has been kind of like, wow, we don't really know who's doing right and wrong in uniform or not in uniform. It's the truth.
Lately they've been acting like
coy little puppy dogs. Like they don't know, they don't see crime. Like see no
evil, hear no evil.
So I'm sorry I kept you there. It was just like a confessional. It was like for all, you know.
No, this is very what you're talking about is the action steps. Therapy work by itself is more about conversations and about those reflections that you presented now. So if you would want to talk and address something from the life, that's the therapy. But action-wise, to talk, this is not what the therapists do. So unfortunately, I cannot be the person that will do any changes in that way. But in that case, there should be a caseworker, because it's different people do different things. And I understand it's confusing. It's also, honestly, it's confusing for everybody, and it's fair. Because every person doing...
I saw you do it.
I saw you do this because people communicate with body language. That's why I don't understand, like, protocols like what, keywords or whatever. That's why I told you, if you do something, I understand, right? Because I could be like that too, because people could get very catty when, they're threatened, you know? So, like, I understand that, you know? And I'm telling you that I appreciate the lack of action like that. But if someone was to subtly, like my friend, for instance, if you were to
get together, or with his father,
who I know is also, I don't know why, I don't think he should be an FBI agent, but he is, would to show me a badge and come with
me, like, come show me something
like that, like
gives me an identity that's far away from this, where there's
no more target on my head and nobody's poisoning me, I will take it.
I will take it. For
me, my son, and my daughter, that's all I need. This other person that stays here sometimes, I don't know what the hell he needs, honestly, because I've tried to have conversations with him,
and he's a nice person,
but I can't have a conversation with him.
No, unfortunately, our time for today is over, so I will need to leave you at this. But as I said, I'm hoping that the appointment with We Care will go well. I hope it's not going to go as bad as you expect it to go. And I hope that there will be some actual conversations and maybe even some, plans.
Okay, but I'm just telling you
from my heart, if you talk to the FBI police,
before, because I've talked to them
about you as well, So if you
talk to them, I
promise, swear to God, swear on my life, I won't sue you because I'm so sick of this. And
maybe I'll regret it, but
I don't know. Maybe it's just the emotion in me. Maybe
people see like ego likeness, like
Oh,
I like
I-
your
tattoos or something, even if they're fake.
Same as in the beginning, I don't know what you're talking about because I've worked brand rep BCC. I don't know what FBI things you think I'm working with, and I don't. So there is nothing I can tell you. There is no update on that statement.
I don't know. I can only speak for me as well. Like same thing that you do with me, like I'm doing that to you.
I can only speak for me,
Okay, well, have a great visit to We Care, and please encouraging you to call the clinic to speak about everything that you
I'm gonna encourage them to
call the clinic because they're also, that's why, we're having this
appointment before them.
I really gotta go. I'm on timing today.
Like maybe they're pissy that, like, oh, it's your patient. I don't know.
Yes, I
Because
gotta
people
go.
can be that lame that they have this day job, and
Ilona,
it's a
we gotta
scary
wrap
city
it up.
like this. Okay, we're wrapping it up. I'm gonna go. Take care.